Hi, I'm Bill Doherty, co-founder of the Doherty Relationship Institute, and developer of something called Discernment Counseling for couples on the brink of divorce. And I want to tell you about how we value therapists learning discernment counseling, therapists who practice in many different ways. We have therapists who have specialty training in all of the major models of therapy, couples therapy. We have trainers in the models. We have lots of therapists who put together their own varied approach and it works for them. So lots of ways that people do their couples therapy, which is all great, which is all good. And what we're doing with discernment counseling doesn't shift that. It doesn't tell you to work differently. You're not learning a whole new way of working with couples, of assessing couples and intervening with couples. What you're learning is a special kind of pre-couples therapy, a bridge to couples therapy. Because a mixed agenda couple, which is what we talk about in discernment counseling, is one in which at least one of them is thinking of leaving the relationship, leaning towards divorce, and very ambivalent about trying couples therapy. They have two kinds of ambivalence, about staying and about whether they want to work with you. Usually the other person, the leaning in one, we have leaning out, leaning in, they're eager to be in couples therapy and they want to save the marriage. So these couples create a real challenge for us as couples therapists. What I'm saying is they're not ready for most of our full-blown models, the models being based on the fact that you have two people there at least want to hang around for a while and try the therapy. So discernment counseling you do to see if they are ready and willing to do the couples therapy that you offer. And some will sign up for that. Both of them, the leaning out one will say, yeah, I'm willing to try. And we talk about a 6-month commitment to couples therapy. In that case, you shift from a discernment counselor to whatever couples therapy model you do. In fact, in the training we say, when you do your discernment counseling, which is no more than 5 sessions, you announce each time, this is our second, third, fourth session of discernment counseling. You're not intervening to help them get closer emotionally, to solve their problem. You're not doing the therapy stuff. You're helping them get clarity and confidence about a direction. You're helping them understand their contributions to the problems. That's what you're doing. You're not doing couples therapy. You're doing discernment work. If they both decide they want couples therapy, well then you shift. And in the following session, what I say is, this is our first session of couples therapy. And then do what you do. Do what you do. But at that point, you have two people who are signed up to hang around for a while in the relationship and to work with you. Now, they also may have decided, usually one of them decides to end the marriage and go for divorce. If you offer help to people for that process, that's what you offer them, or you make referrals. So you make a transition to your couples therapy work or your divorce help work, and you do what you do. You do what you do at that point, but you've done this kind of specialized pre-couples therapy work to see if they are ready for the couples therapy you do.